a device to capture and test women's menstrual blood to monitor biomarkers like cervical cancer, fertility, thyroid health, STIs, endometriosis, and more is in development. And one model is FDA cleared and available now. It tests for A1C, which is the average blood glucose over the last 3 months. The testing kit is used just like a pad. During a woman's menstrual cycle, they place it. Then after it's used, they mail it in and the results are sent to a smartphone app. The implications of this device and the story behind it are fascinating, and I'm gonna get into all that. Welcome to the show. I'm Justin. I have type 1 diabetes, and on here I talk all things diabetes tech, news, and management with industry leaders, physicians, and those thriving with diabetes. Today, I'm speaking with the enthusiastic Dr. Sarah Naser, founder of Qvin, spelled Qvin. Together, we get into the power behind a woman's menstrual blood and how it could revolutionize early screening and women's health. Plus, we get into how the test works and how a test is already being used to screen for cervical cancer in Southeast Asia. We also dive into Sarah's journey here, from developing a molecule with the potential to prevent and block skin cancer, to working with a robot named Betty to simulate a woman's cycle. As a man, I have to say, I found this conversation way more thrilling and interesting than I thought I would. I also had cancer at the age of 21, and I was lucky enough to get screened early, where we caught it early enough where I was able to get it out and I didn't have to go through intensive chemo and radiation. So this actually hit me harder than I thought it would. We are also going to be putting a poll up on the newsletter, so you'll want to sign up for that with the link in the show notes. As it relates to this whole thing, I actually get into it in the episode. And if you are on YouTube, make sure that you comment with your thoughts, give this video a like, and be sure to subscribe if you aren't already. And if you're on YouTube, you can go listen to this on podcast platforms if you kind of want to listen on the go. We do put images on YouTube though, so it's always an enjoyable experience watching it in video. Keep in mind that anything you hear on this podcast or any of my pages is not medical advice and is for educational purposes only. Always consult with a physician before making changes to your healthcare. Dr. Sarah Naser, it is so good to have you on the show. I've been watching some of your speaking presentations and reading up a lot about your product, and I'm just so excited to learn more about this and hear more about you.
Thank you so much for having me. I'm very excited to have this conversation as well.
Of course, before we get into Qvin and the Q-Pad, I want to understand more about your background. What led you to where you are today? Can you tell us a little bit about your journey so far?
Absolutely. So I was actually in medical school when the idea for Qvin popped into my head. And I think partly I had seen in practice and of course knew in theory how time is such an important prognostic factor, but very rarely did patients come sort of at the earliest onset of disease. And so that was something that always sort of was on my mind. Well, we know that it's so important to detect things early, yet we really don't have good ways to do so. And patients rarely come, early enough for it to really be preventative. And so I was thinking through that quite a lot and, thinking through why is it so hard to be preventative? And I think part of it is it's actually really hard to get information about what's going on in our bodies outside the doctor's office. And we've seen almost like this explosion in medical devices that they're sort of trying to do that, give us information about what, our bodies outside the doctor's office, and we can track, our pulse and our steps and our sleep, and we're doing these kinds of things. But it's not always very clinically relevant, all this data. And so, I wanted to find a way for us to be able to get information about our bodies regularly, conveniently, but where the clinical utility was there too. And so blood became, of course, blood being the most commonly used bodily fluid for any diagnostics, blood was top of mind. And then the question became, well, how do we get access to blood regularly, non-invasively, conveniently? And that's sort of when it hit me that, hold on a minute, half of the world bleeds every month. Like, why has nobody looked at that? And so that was sort of just a thought that popped into my head. And, the first thing you do, you go on PubMed, you go to look, what have we actually published on this topic? What do we know about this? So surprising to me, there was really very little information about the diagnostic utility of menstrual blood. And in fact, there was only one paper published on the proteomics of menstrual blood, at that time. So kind of that was sort of the beginning of Qvin. It then led me on this journey of first really trying to understand what the clinical utility is and doing some very basic research in collaboration with Stanford University Hospital for the first couple of years. And then once we understood what it is, and if there is clinical utility, the next thing became, well, how do we build a medical device that can capture that opportunity consistently and conveniently? So that's a little bit about the background story.
Yeah, but tell me a little bit more about your background as it relates to your career.
So I'm actually from Denmark. Originally, I was born and raised there, and so is my co-founder. So I started medical school in Denmark, did a bunch of research throughout that, which among others led me to the US, where I studied at Stanford University Hospital, doing some research with them. And then I graduated medical school, and the idea for Qvin was already kind of born at this time. And I would say we had already done, some of the foundational research that led to our understanding of where this could potentially be helpful for patients. And so after that, I really started to dive, sort of spending my full time on women's health, and in particular in understanding how we can make this very abundant bodily fluid valuable and useful for women, and accessible for women in terms of medical, right? In terms of healthcare.
I read that at 17 you developed a molecule that held potential to prevent and block skin cancer. Can you tell us more about that?
Yes. Oh yeah. You've got really back in history here, but
yes, I had to prepare.
That's awesome.
Also, I had cancer when I was 21. I had neuroblastoma, so it's something that's important to me.
Oh, absolutely. Yeah, so I think in many ways that actually probably is what opened my world to this idea of, entrepreneurship and really launching projects. So yeah, I was quite young. I was passionate about this prevention in skin cancer in particular. And really the background story there is I had a close family friend who actually died of skin cancer. And so, as a young person, that was something that affected me. And I thought, what can we do about that? And ended up coming up with this very new chemical compound that utilized this thing called the buckyball, which is this it gets very nerdy, Justin. It gets very nerdy over here. But it's this very, very cool molecule that actually is almost like a soccer ball, formed of carbon molecules, so very stable. And then you can actually open it up, chemically speaking, and you can put other molecules inside of it. So the idea was to take an ozone molecule that has very high protection of UV radiation and then encapsulated it into this very, very stable structure called the buckyball. And then in that way have very high and actually, very, very good UV protection against the harmful rays to prevent skin cancer. And that was the first, that was my first sort of company that I started at that time. And I learned a lot through that journey, moved to different places in the world to kind of develop it, worked with different university hospitals again. And it kind of taught me, how you do that. And so when I eventually came up with the idea for Qvin, a lot of learned lessons from the first couple of years of doing this other company. And I think that is probably also the reason why I ended up studying medicine and becoming a doctor, because that sort of spiked my interest. And I learned at that time that, what I really wanted to do and what I really cared about ultimately in how I spend my time is in helping people and how we can make people's lives better, healthier, and more better quality of life, right?
Yeah. Why did you just decide to move on from that project and kind of focus on this one?
Yeah, so we worked on this project for a number of years, and actually with a Nobel Prize winner at Yale, we developed the first models of this molecule. Long story short, I actually moved to Japan, where they do a large-scale manufacturing of this particular buckyball. And what we learned is, it was very hard to scale manufacturing because ozone is just a very reactive molecule. And so even when we did it in many different ways where we actually didn't even work with ozone, but we would create it inside of the buckyball. It gets kind of into the details here, but ultimately the challenge was that it was very hard to scale manufacturing, which is one of the things we've solved for very early on in Qvin. And so, after that, I sort of took a step back, and I decided to go to medical school. And then, a couple of years, I would say probably 4 years into medical school, the idea for Qvin came. And so that's kind of how it all transitioned into women's health from that point on.
Speaking of women's health, I read on your website in all of my research that it wasn't until 1993 that women and minorities were required by law, I assume in the US, to be included in clinical trials. Can you kind of explain to me where we are today with women's health, kind of maybe what's happened over the last 30 years? Like, what is the status of our understanding in that department?
I think a lot of the ways we think about, in particular, reference intervals, when we think, when we talk about what should a specific level of a specific biomarker be in a specific population, a lot of those studies are quite old, right? And so I think where it becomes really tricky is when we are basing diagnostics on studies that were done predominantly on male biology, right? I think, even fast forward, it wasn't really until the year, 2006, I believe it was, that even when we think about how we develop drugs and treatments, that, female rodents are required to be part of some of those trials, because historically, actually a lot of those trials have been done on male rodents, because female biology is just a little bit more, it's different, right? It's perhaps a little bit more complicated. And so historically, female biology hasn't necessarily been represented, not just, in clinical trial, but also in, drug development. And so in general, we are just lacking data on female biology, and in particular, how it relates to diagnostics and treatments. I think we are certainly in the last 10 years at a point where I think women's health is certainly having a moment, if you will, and there's a lot more awareness now than there was. I would say even in our journey with Qvin, we've actually felt the difference in how women's health is received, and the conversation around and the attention around women's health. So I do believe that we are on the right track, but to close the gender data gap that exists in healthcare, it is something that is going to require time and effort and investment. And I think the awareness and the conversation is there. We still need to catch up on the execution of catching up. And it requires that, of course, also women to participate in medical research, right? And to want to be represented in studies, and for researchers to put in the effort to recruit females in particular for some of these studies. But I do think that historically we are behind, and I still think that we are lacking that participation. And we even know that when it comes to conditions that predominantly affect the females, we are studying them predominantly on male biology.
This episode is sponsored by Omnipod. You guys know that staying connected to the tech world is important to me, but what's also important to me is my insulin pump. Omnipod 5 is tubeless and waterproof, which means I never have to disconnect from automated insulin delivery, even when I take a shower, go swimming, or go to the gym. Staying connected to my insulin pump means I'm spending more time in automated mode, which ultimately helps me spend more time in range. See if you're eligible for a 30-day trial by visiting omnipod.com/diabetic. On there, you'll see full safety and risk information and trial terms. Again, that's omnipod.com/diabetic. Qvin stands for, or that means woman in Danish?
Yeah, so exactly. The word comes from the Danish word kvinde, which means woman. And so because both my co-founder and I are from Denmark, that name was sort of top of mind. And we do, there's some values of, where we were, the society that we are from, that we really, really, we love, and that we wanted to bring into the company. And so eventually that became the name. But yes, it comes from the Danish word woman, kvinde.
And so you founded Qvin in 2014. So it has been 10 years. It has been a journey. Can you tell us a little bit about that journey and maybe some of the obstacles that you've encountered in order to get the Q pad into production?
Absolutely. Yeah. It's like, oh, looking back the 10 years, a lot has happened. And man, it has been a journey. The very early days, I would say so the journey of the company early on was focusing on, we were sort of starting from scratch, right? We didn't even know, frankly, if there was any utility in this particular bodily fluid. So the first couple of years really were basic research in understanding if there is clinical utility, let alone what that utility was, right? And the obstacle at that time was actually finding, and this is something that, as a woman and as a medical doctor myself, that surprised me, that even from the medical community, there was a sort of a pushback on menstrual blood and a stigma around menstrual blood, which made it hard actually to do that research and finding laboratories that were willing to even run testing on menstrual blood. Even very, very well-known clinical research labs, we had pushback, and there was this ick factor certainly at the time that kind of became very hard to overcome, even with within the medical community. And it's funny to me, Justin, because we've researched and we understand and we've talked, we know utility when we know for any other bodily fluid, right? Blood, of course, urine, sweat, even tears we've looked at.
Even stool testing.
Exactly.
So come on. What's
exactly. Yeah. The feces, and
right?
So it blew my mind. It was like, why that kind of pushback on menstrual blood? And I even had a colleague when I started doing this research who was like, that's kind of gross. Like, you're doing research in menstrual blood, and this particular person was actually doing feces research. This is now 10 years ago, and so just to say that there was a taboo stigma and a ick factor around menstrual blood that made it hard in the early days. And I think the very awesome journey that we've been through as women's health is also becoming kind of there's more awareness around women's health. But certainly we felt that from the early days where it was about opinion almost, as we did the research and published data and we continued to kind of put in the work and share the results with the community, it's at some point was no longer about opinion, right? Which was very refreshing, that we could sort of stop talking about what you think is a waste product or not, and really start to say, well, the data speaks for itself and there is absolutely clinical utility here. And now let's talk about how that can be helpful for patients within the US, but certainly also abroad, where there is no clinician perhaps to take a sample and to provide that data. And that has been an incredible sort of a change in the conversation that we've experienced as a team at Qvin. And so that was definitely, but that was the obstacle early on. And then, once we understood that there was utility, the next thing was, well, how do you build a medical device that captures that? And menstrual blood has some challenges in that it's unpredictable when a woman has a period, and the flow of a period is very different between women, but also for a single woman, it is very different depending on the time of day. It's basically very hard to predict, right? And so that makes it a challenge to run clinical trials and even kind of building a medical device around that, where the flow is very different, and depending on if she's sleeping or walking or biking or running, or there's different factors that impact the collection, right? So the next obstacle, frankly, was, well, how do we standardize that so that we can do really good product design and good science, and that we can keep one variable, have one variable and everything else constant. And so actually that led us to we had to build a robot. We call her Betty. She's our menstruating robot. And early on in Qvin's journey, that was actually how we did product development until we had a system that was stable and that worked really well on Betty. And then we started kind of recruiting women. And
What did Betty do? Because obviously Betty's not producing real menstrual blood, right? Like, what was it that Betty was helping you with?
it was in particular being able to vary the flow rate of blood coming onto the system, and also the pressure at which the system is put on the system, right? Because it matters when you are filtering the blood and you're collecting the blood. These variables become very, very important. And so this was a way for us to really, through thousands of iterations, build a system that sort of, no matter the flow rate and the pressure, whether it was a little pressure or a lot of pressure or flow high or low, we were able to see that the collection was successful. So that was Betty's purpose for us. And today she's retired, but she's still a big part of our office, and has been a pretty key component in accelerating some of the product development that led to eventually what became the QPad. Yeah, and then of course, I mean, as any other company, you got to fundraise. You got to find the people who have the know-how, and who have, really more importantly, the grit to stick around through the many, many, many ups and downs that certainly exist in I mean, many early stage companies, but certainly also for us in the last 10 years. So that's just some of the
Did you have a
examples.
lot of did you have a lot of female investors interested?
So it's very interesting because 10 years ago, there really weren't I mean, still, of course, it is well known that, we are lacking female investors, but 10 years ago, there was really very few. I don't even recall, if I ever sat in a room with a female investor during fundraising meetings. That has changed. In the last, maybe, I would say probably 5 years or so, there's not only more female investors, just from my experience, but I feel like even in, funds that are focused on women's health and perhaps even female founded companies, they tend to be a little bit earlier stage because it's more new. And we are a little bit later stage for some of these, unfortunately. But had they been around 10 years ago, we would have loved that. But at the time, there really weren't very many female investors, unfortunately.
Yeah.
But that's something that is changing. So that's something we're excited about for sure.
Yeah, now the QPad, which is available now, and we're going to get into in just a bit, that tests for A1C. But I know that you see potential for this test and menstrual blood to be used for testing a whole bunch of biomarkers. In fact, you've put out a bunch of research with institutions like Stanford University School of Medicine. Can you tell us a little bit about that research that you've put out and kind of the implications of a test like this?
Yeah, so we've actually validated a number of clinically relevant biomarkers that range, really sort of broadly speaking, when we think about healthcare, things that you would regularly get tested for, we would regularly test a patient for in the clinic, we've looked at in menstrual blood, right? And so when we do studies, we ask women to use the QPad, and then very shortly after that, they come in and we do a venipuncture, we do a venous blood draw. And we then take both samples and we process them using the same analyzer at the same clinical laboratory. And we can then compare, okay, and this is just an example, let's say something like, a vitamin D or something like that, right? If I then look at the level in your venous blood and I compare it to the menstrual blood, how does that correlate? And so we've done quite a bit of studies on that. And what we know is that, I'll give you examples of assays that we certainly know works. So hemoglobin A1C is an example, but in addition to that, something like the fertility hormones, we know we can monitor thyroid hormone. We've looked at hemoglobin, we've looked at different inflammation markers as well, and then I say very interestingly, and something that we're really excited about internally here is that we have done a number of studies on the opportunity to screen for cervical cancer using the QPad. And we did one
Wow.
study which was funded by the Cancer Institute of Stanford, actually, and that was published. And we are seeing that the QPad is able to detect the viruses that cause cervical cancer very accurately. So we've done a number of follow-up studies on that, and it's something that we're working really hard on, being able to offer women in the US, but also outside the US, where there is no clinician to do a pap smear. So these are some of the examples of areas within healthcare that we are that we know are possible to monitor through the QPAD and through menstrual blood.
What do you think the timing is for other biomarkers? Do you see some of these coming out shortly after the release of your current model with that test A1C?
The answer to your question is, I thought a very long time ago, well, I'll say maybe not a very long time ago, but I thought by now this would actually have happened. And there's been quite a few changes in the regulatory framework. In fact, this year in July, there was actually almost a paradigm shift in how FDA regulates clinical laboratories. So not specific to Qvin, but in general, clinical laboratories. And I think it's still a little bit unknown what the outcome of that will be, especially with changing like government. And so it's really hard for me to answer that question. We care about, as we've done with the A1C and the QPAD as a medical device, we work really hard on taking that through the FDA, and actually a lot of companies don't even do that, right? But that was important to us, and so we are sort of navigating the changes in regulatory framework right now, and I hope very soon that we'll be able to release these assays, but it is a little bit unknown at this time exactly when that will be.
Well, thank you for answering all of that. I feel like I have a really good understanding of you and everything you've worked on and Qvin, and now we can get into like the product that is available now, which is the QPAD. So the QPAD tests for A1C, which is the measurement of the last 3-ish months, the glucose levels, right? Who do you envision that this test would be used by?
So, of course, hemoglobin A1C is a biomarker that we use to diagnose patients that may have diabetes, prediabetes, gestational diabetes. A lot of women also test who are very interested in wellness, and your average blood sugar is actually just a very important measure for your health regardless of conditions. But for the QPAD hemoglobin A1C test in particular, what we really hope to do here is to help women who are living with diabetes, who have to go in and get tested regularly, to really be able to do that with this alternative approach that doesn't require them to go in and get a needle poked into their arm, but really just kind of as they're bleeding anyways, why not give them the data that they need. So that's an example of a population group that we are, that has been our first sort of hope to improve the quality of life. So that's kind of that's the intention behind the hemoglobin A1C test. We are seeing that that there's a lot of interest from women who are also who may not be living with diabetes, but may have prediabetes or may have diabetes in their families, or may have had gestational diabetes during pregnancy. And of course, there's women who are just very interested in knowing what's going on in their bodies in general. But that's kind of where the intention was with the hemoglobin A1C. And also, for our FDA approval, we took the QPAD through the FDA process to show that the QPAD is an effective way to collect menstrual blood, that it is stable as you transport it, right? Because, of course, this is intended to be used at home. And so women are shipping this from everywhere in the country. And so part of it was to show that this device is consistent and stable. And then we tagged along the hemoglobin A1C assay with the indication of being able to monitor women who are living with diabetes for that as an alternative to what they have to do anyways with their 3-month blood draw.
Yeah. Do you think, or are you speaking to doctors about, hey, if you're doing telehealth with some people, like why don't you include this in, if they're not going to come in and get the blood drawn, someone can just do this and then talk to their doctor. Kind of, what are your hopes or goals for your product to be kind of implemented into that kind of relationship, virtual relationship with a doctor?
You're actually completely spot on that this fits in super well with the telehealth world, right? Because when we can't see a patient in the clinic, we can only get so far with getting on a video and talking and asking about symptoms and looking at each other and sort of assessing from a video. At the end of the day, to really, understand what's going on, we need data. And so blood being the most commonly used bodily fluid for this diagnostics in general becomes a very important tool for a clinician to understand what's going on. And so that's sort of where we see the QPAD potentially come in and say, okay, this is a way for us to collect blood regularly and non-invasively from a telehealth, virtually, if you will, right? So that is certainly a use case that we are excited about. But also, when we talk to clinicians, in particular, we were talking to a fertility doctor, and I remember, what they were really excited about was that sort of today there's a lot of pressure on, and there's quite a long wait for a woman who may need a fertility assessment, who is wanting to have children and to be seen. And usually the first thing we do for this patient is actually we ask her to come in and we do a blood draw on the third day of her period for some specific hormones. And so you sort of come in and you wait all this time to get in there, and then that's the first thing we do. And then you have to come in, maybe a couple of days or a week later for the results. And some of the, how can we sort of make this more effective? And there's a world in which we could say, you're bleeding anyways, it's the third day of your period. We send you a QPAD, we get the data, and when you show up in the clinic, we already know what's going on, right? We already have the baseline of what's going on with your health. That can then now this visit can become a very productive conversation about what is the next step, what can we actually do with this data. So it's almost like it saves you a visit, and that way, we'll make the sort of the process of how we provide care more effective and hopefully more cost effective even, right? So that's another way, even outside of the telehealth application.
How does the QPAD test, or does it differ from a test you would get in the office? They take a lot of blood in the office. Is that a different way of testing the A1C than what you're doing here?
No, actually, you're right that usually when the blood draw is performed, we do take more blood, right? But actually rarely is all that blood being used. We don't really need all that blood to run testing. And so nothing is actually different when it comes to the laboratory. So when you enter a laboratory for how we run the QPADs, it is exactly the same as any other clinical laboratory you find in any hospital. In that, it's the same machines, the same reagents, same FDA approved analyzers that you will find. Nothing is really changing on the laboratory side. It is really about the collection. How is the blood? How are we accessing blood, right? But in terms of how it's run, it's actually entirely the same. And that's sort of how, I think that's sort of even how we run the studies and how we validate these assays is we keep the laboratory procedures exactly the same, right? Of course, there is a difference in how there's some of the pre-analytical steps that are a little bit different because we're dealing with a dried blood spot rather than a liquid blood. But I would say even then, it's been, there's sort of for the past many decades have we run testing in the clinic on dried blood spot. In fact, all newborns are tested using dried blood spots. So the technology is not foreign to any laboratory either. So of course, when you compare dried blood spot to what we're doing here with Qvin, that procedure is very similar.
Can you explain to me like the different components someone would use when they get this test?
Absolutely. So you can order the QPAD test on Amazon or on Qvin.com. And when you do that, once you've ordered a kit, a couple of days later, it will show up via mail at your address that you provided. And what you receive is a little box, if you will. It's a little envelope, actually. And when you open it, what you'll find is 2 Q-pads that when you open one of them, both, they're the same. But when you open that Q-pad pouch, it looks and feels, and it's actually used exactly like any other menstrual pad. The Q-pad is built on organic cotton, so there's no chemicals added, which is good for many reasons, but in our case, of course, also because we need to sort of maintain the integrity of the blood samples. That was very important for us as we were building the Q-pad. And so women use it like they would any other menstrual pad. I would say on average, women use it for 2 to 4 hours. Before you use it, there's actually a QR code on the pouch that you scan, and that takes you to an app, the Qvin app, which tells you the instructions of how to use it, and sort of activates the kit, if you will. It's sort of the app basically functions for 2 reasons, really: giving you instructions, and then also it's how we share the results. So once you scan that QR code, then that is now locked in the app, and that's how we know when we receive it where the result needs to be shipped. So then, that's sort of before you start collecting, you can use the QR code. But then, you collect, just like I said, really like any other menstrual pad. Women, wear it for 2 to 4 hours typically. When you've saturated the pad, there's a little tab in the front that you can pull. That removes a small collection strip. You throw out the pad like you would with any other pad, but that small collection strip you then place in a little collection container that comes with the kit, and it's pre-stamped. You put it in that container, and then you throw it in the mailbox. And about a week later, you will receive your results on the mobile app. So that's sort of how it works in terms of functionality.
Does the app say like, hey, your A1C is a little high, you should consider talking to your doctor about this?
Absolutely.
Does it offer recommendations like that?
It does, yeah.
Okay.
It does. So yeah, exactly. Depending on the A1C result, it will recommend and perhaps even sort of say we recommend you go see a medical professional to discuss this result. You can very easily share the results with a physician as well. If you wish to do so, you click a button and it spits out, where the app shows you this very user-friendly way to interpret your results. Once you share with your clinician, it actually spits out the very boring laboratory report that clinicians are very used to seeing. And that is then you can then easily share that with the clinician, so they are familiar with the interface, if that makes sense.
Okay. And I forgot to ask one of the most important questions, but where is this available? Is it the US right now only, or is it elsewhere? Is it coming elsewhere? What's that look like?
Yeah, so it is in the US, available in the US only. We do have some collaboration with sort of outside the US with some hospital chains that are offering is other kinds of testing using the Q-pad. But for the A1C, that is only available in the US. That's correct.
And when you say you're partnering with people outside the US for other testing, what exactly does that mean?
So we have a big hospital chain in Southeast Asia. They were really, in that particular region, and this is not related to hemoglobin A1C, but actually cervical cancer, because culturally and religiously, women are not getting screened in this region. And it's really, the barrier here is how we screen, right? A woman has to come in, get undressed, get on table, and have a speculum inserted to collect those cells. And so there's in some parts of the world, even a bigger need for more convenient and private and comfortable screening methods. And so we are collaborating with them to offer this particular testing to women in this region. And so, I think it's a very exciting application, and we're excited to kind of move forward with that. But that is not available in the US.
And are you able to do it there because the regulations aren't as strict, or like, is it regulated? Kind of, what was the process of getting it there?
I'm not an expert by any means in regulatory when it comes to outside the US, because when we collaborate with external partners, not in the US, we they typically will handle not only, it's their patients, it's their laboratory, and therefore they are also handling all the validation that comes with that. And I would say that generally speaking, I think the validation process is slightly different, and some of the criteria are very different. However, I think at the core of it is, you need to show data that this system is working. But the requirements for the extent of that validation is slightly different. That's right.
Okay. Today's episode is sponsored by T1D Exchange. You can directly make an impact on diabetes healthcare, treatments, and technology by participating in the T1D Exchange registry. It starts with a simple survey about your life with T1D, and it only takes about 15 minutes. After that, you'll have a personal portal with ongoing T1D study and survey opportunities. Plus, some of these studies even offer compensation. Signing up with the link in the show notes helps support my channel, and it allows me to continue putting out free content. You can sign up at t1dexchange.org/diabetic or click that link in today's show notes. When it comes to someone who's taking this test, sending it to you, what's going on with their data? Are you using that? Are you monetizing it? Are they able to opt out of that? What's that process?
Yeah, oh no, we are definitely not monetizing any of the data. We strongly believe that the data is yours to own, in that, a woman can at any time delete the data, take the data with her to another platform if she wishes to do so. We do have, when you sign up on the app, you can consent to research. So the only way we use the data really is for research. And I think part of the vision behind Qvin is one, we wish to, for women who are using the QPAD to get information about what's going on in their body. That's first and foremost, be on top of your own health and know what's going on and be empowered in that way. But second to that, how can we collectively really come together to enhance women's health? And it almost goes back to the very first part of our conversation, in how we can start to close the gender data gap and understand female biology. And here we have a platform that can do that very conveniently, non-invasively. And so our hope is that we can utilize this data really to learn more about women's health. And that's really through research. We publish that as well. But again, it is something that you would have to consent for. So, if you do not wish to be part of that, then the data will not be used for any research projects. So, and then, the app functions and follows all the different HIPAA guidelines. And, we are following all the, recent and sort of very top privacy guidelines as well. It's something that we care quite a lot about. But it is certainly, we believe it's a woman's choice at the end of the day. And so if she chooses to let the data be used for research, that is how we are using the data.
There are so many possibilities with a test like this. You've named so many biomarkers that it could test. Of all of them, which one are you most passionate about? Do you think could have the greatest impact on society, women's health?
I think it's when some of the things we've talked about, how do we even choose those? And part of it was, well, what's clinically relevant? Part of it was actually that we've interviewed more than 1,000 women, and we've asked them, well, what would you want to know more about? What is interesting or what is important for you in your health? I think for me personally, what I really am excited about is if we can screen more effectively for something like cervical cancer that today still kills hundreds of thousands of women, and is a cancer that is actually entirely preventable, right? No woman really should die of cervical cancer today, because the solution is we have to screen. If we screen every woman, this would not exist. And so what are the barriers to getting screening? And unfortunately, the way we screen today is, in my world, slightly ancient. The way what we require of a woman, there are better ways. And I think it is very promising to see that this could actually become a way to do that very, very, very conveniently, because women are bleeding anyways, right? So could we actually eliminate cervical cancer by making screening accessible? And that's something that I'm definitely very passionate about, among others, when it comes to the potential of menstrual blood.
You've actually inspired me. I want to put a poll on my newsletter on what women, and I don't know if men want to take it either, but what they would like to see most in a test like this, what they'd like to see first. So for everyone listening, awesome. Stay tuned for my next newsletter, and I'll share the information with you too. And awesome. You can put your vote in.
Yes, I will.
Yeah. That's been my favorite thing about my newsletter, is being able to put out different surveys like that and polls and get to understand what my listeners want.
Yeah.
A future of tests like the QPAD that take a whole swath of biomarkers and give people this information, it does seem to be, the future of telehealth and kind of where we're already heading. What do you think the impact of a device like yours, when it does all of this, and other devices that come out and do things like that too, what would be that impact on the healthcare industry?
I think where I really see impact is in accessibility, right? At the end of the day, when we innovate in healthcare, it doesn't make sense to build solutions that are inaccessible or expensive or hard to kind of get to. That's not a solution, right? When we innovate in healthcare, as we come up with solutions to health problems, it has to be accessible. And I think that is really the power of the QPAD, is that it is very accessible. It's built on accessible materials like cotton and paper, right? It makes it easy for women to get screening done because they can do it at the comfort of their own home. It's actually really interesting when we ask women what they were doing while they were getting tested. Women report back, well, I was in school, I was picking up my kids, I was doing groceries, I was at work, and that's exactly, I think, where we need to go with healthcare. How do we make it easy for people to know what's going on in their bodies? And I think in particular, women want to know. They actually care a lot about what's going on in their health. But to get access to the information, they have to take time off from work, book a time at the doctor's office, go in there, sit there, convince the doctor that I really do need this test, et cetera, et cetera. And so how do we make it more accessible? And, even for a lot of women, you may not live, of course, for the population that live in these big cities, they might have a little bit more easy access to going. But for a lot of, even America, there's a lot of people who do not have an OB-GYN. It's a 2-hour drive, and you're also working, and you are also taking care of families, and so it is hard. It is hard to get this data. And how do we make it easy? How do we make it affordable? How do we make it accessible at the end of the day? And that is actually where I think the QPAD really has some very interesting dynamics.
Yeah, so, I love the accessibility of a product like this, especially for people who aren't using continuous glucose monitors like I am, because I'm able to see, the average over a certain period of time with the GMI that it provides, which is, a similar marker. But there are so many people that aren't wearing CGM that could benefit from a device like this. Sarah, thank you so much for coming on the show. You were so fun to talk to, and you're so enthusiastic. I love your mission. It was so interesting to hear about the product, how it works. I learned a lot about women's health, and I'm excited to see where this goes and to watch from afar your journey. And I'd love to have you on again when there's new advancements here.
That is awesome. And thank you for having me. And again, I think we are really just very early in understanding the potential of menstrual blood and just scratching the surface of what's possible. So it'll be interesting, certainly in the next coming years, what we can do and how impactful we can make this for women. And so thank you for having me. Thank you for wanting to have this conversation and for all the great questions. I really appreciate it.
Of course. Wow, I am super excited to see where this goes. Also, if you want to check out this test, I put a link in the show notes. It's maybe an affiliate link. I was going to sign up for their affiliate program so I can get a little kickback for the ones that are sold. That's not why I did this episode though. I actually discovered that after. So yeah, if you want to purchase one through that link, it helps me out. The poll I mentioned in this video will be up on the newsletter soon. If you're not already signed up for the newsletter, you can do that with the link in the show notes. It only gets sent out to emails. You can't find it on the website. You can only find the articles we put up on the website, which are also pretty interesting. Comment on YouTube with any thoughts you have, and give this video a like on YouTube if you're watching there. I'm Justin, and I'll see you next week.